I'm Von Biggs, and let's queer up health. Medicare targets price cut for key HIV drug. The federal government is moving to lower Medicare costs with the widely used HIV medication, a step with major implications for LGBTQ communities, seniors, and people living with HIV. The Centers for Medicare and Medicaid Services announced it is negotiating prices for 16 high-cost drugs. Among them is Biktarvy, a once-daily pill used both to treat HIV and as post-exposure prophylaxis to prevent infection. The drug is made by Gilead Sciences. Biktarvy use has surged since its FDA approval in 2018. More than 100,000 Medicare enrollees used the drug between November 2024 and October of 2025. Wow. During that same period, Medicare spent over $3.9 billion on it, while Gilead reported $13.4 billion in Biktarvy revenue in 2024. These negotiations are possible because of the Inflation Reduction Act passed in 2022 under former President Joe Biden. While the law received no Republican votes, its drug pricing provisions are now being implemented under President Donald Trump. Any new prices, including for drugs like Botox and Trulicity, will take effect on January 1st, 2028. The interesting thing is, this story's probably not done. I'm sure we're going to hear. We're going to get more on this. Mm-hmm. I always view it as you have to compare apples to apples. And if you're going after Gilead because you say, oh, in a year's time frame you spend this much on the drugs, but then you look at a competitor's product and over a year's time it's the same cost, but nobody's attacking that one. Mm-hmm. It's like who's got it in for them, and that's kind of what I'm looking to see.
These numbers of billions that they just keep throwing. I'm like, how is this drug even costing anyone anything? I mean, any of these drugs that the numbers are so insane. Mm-hmm. But at the same time, we need them for our life, and where else are we going to go? I mean,
it is a standard of care. I mean, Biktarvy is the one,
it's the one.
It's the most common one used because there was nothing out for a while.
I don't understand why it's so much cheaper to treat HIV infection in places like sub-Saharan Africa, but then you get to a Western country and it's multiple hundreds of thousands of dollars per year. So there's got to be
the same thing for those people go to many different places to do things like that. BBLs and
turkey teeth
operation and denture renewal, outside of the States because of that exact reason.
I hear Colombia is a great place for some cosmetic stuff. I've been looking into it, so I do understand that motivation, but I do think that the prices could be brought down, even further. And I mean, this is a great start.
I mean, we're seeing it. We're seeing it here in Florida where they're cutting, Biktarvy out of ADAP, completely, and it's a matter of like, okay, but why? And are you comparing? I always want to compare apples to apples. I want to see what's it across the board, not just one drug. Because to me, that feels like you're targeting
someone.
You're
a numbers guy.
Right.
Yeah.
To see it.
Mm-hmm. And it's nice to hear this too, that it's something else for which we can be grateful to Joe Biden and his sensible administration. Oh, we miss you, Joe. We miss you.
I wrote Joe Biden in all capital letters, but I had a feeling, icon Greg Shapiro was going to make a statement about Uncle Joe. We love you, Joe Biden.
We miss you.
Yes, just come take a seat at the round table.
Yes.
But I agree with you, Von Biggs. I think we'll report on this story again another 6 months from now with different, numbers being thrown at us.
For sure.
There is no other queer nonprofit media platform like this in the entire world. Support our LGBTQ stories by sharing them and subscribing to Queer News Tonight.